entailed. So we will be able to quickly show what we're doing and how we're going to meet that need. Entrance, egress, and movement within the school. I think you heard some of the principals talk this morning that they already have those things in place, but we have all of that in place district-wide. Face coverings and other essential protective gear, not an issue for us whatsoever. The health screenings for students and staff, we have that in place, and that's not going to be a hindrance. Healthy hygiene practices, from all the information that we've already provided that's available on our COVID-19 website, all of the signage that's throughout all of our campuses, we have confidence that that's complete. Again, thanks to Tommy Almatari and other people who have now been trained contact tracers. We have no problems identifying who's taking care of all of the contact tracing. Physical distancing, that's already in our established MOUs, how we're going to keep students at least 6 feet apart, and we could quickly complete this section. Staff training and family education, we've already done a lot of that, but we would bolster that in ongoing and frequent communication to all of our staff and families. Testing of staff and testing of students is where it gets interesting. So we would need to talk about that. It's easy for us to talk about it when we have a symptomatic situation or someone's been exposed. We're already doing all of that. The issue comes in the blank section where it talks about staff and student testing cadences. And you notice it says, please note if testing cadence will differ by tier. So that's the piece that we still need to work through. We need to get more clarification of what the guidance really means in terms of a requirement or optional. But we already have this taken care of too. Ms. Almatari is the person who all cases are reported to. We have a robust communication plan already in place of how we communicate to any staff members about cases and exposures at schools. If students are back, that would obviously pertain to students and parents as well. And then this is just proof of consultation for schools not previously open. Our current plan of coming back in the red, that work's already completed, right? We have a couple of classified units that we still need to get our current UMOU done. But with regard to EGEA and a couple classified units, that piece is complete, but we don't see a problem there either. And then if you're in the purple tier, this last section is you have to get approval from your local health officer in approving your safety plan. And that concludes my presentation.
Now you understand why we split it in two, because it's a lot of stuff. Beth, you're muted.
You're muted.
All right, thank you.
I do want to say though, before I conclude, and I had this on my last slide, but I lost it when I shared the other document. So what we do know is this is still working in terms of the governor's incentive program. It's a proposal. It's working its way through the legislature. Yesterday was an interesting day at the Senate. There will be another interesting day. I believe it's next Wednesday, the 25th, on the Assembly side. And we will stay tuned and see what happens.
So just as an example, we did get a report from someone who spends a lot of time in the Capitol and in these kinds of sessions. And one of the things he said yesterday was, I can't remember a governor's proposal being treated so roughly. It may not be totally back to the drawing board, but expect significant changes before if it gets adopted. So it was, I know Ms. Albiani was part of the, I listened to part of the Senate hearing yesterday. I did as well. And labor, management, everybody was united that some good ideas, so that, but significant challenges, timeline being one of them, the amount of money related to what the cost would be to a district to implement it, a great deal of concern. So it was a very interesting listen for sure.
Madam Chair, I also listened to that hearing in its entirety and had the same reaction. I can't remember when I've seen a governor's proposal so completely dismantled in such a consistent way by people, by stakeholders in every area, right? State, local, labor management, as Chris said. So just let's highlight that in terms of managing expectations. I know this is a lot of information and I know it's hard to follow, but I'm just going to further differentiate between two things that Mr. Pierce just covered, because he covered both the governor's proposal, which, you know, did not have a warm receipt yesterday in the Senate, and the new California Department of Public Health guidance. So two new things that are interrelated, but one of them is out, is effective, and that's the guidance. And the other is the proposal, which will probably change if in fact it does move forward. So just wanted to help clarify that for folks.
Excellent point.
Okay, Rob or Mr. Hoffman, did you have anything else before? Okay, Dr. Martinez-Solir?
So a lot of information to digest there. I appreciate the level of expertise and the information that had went together. Again, I think reintegrating the plan that we do have is important. I know you alluded to there are conversations that are happening around the plan to vaccinate instead of the plan for testing. I just wanted to get your perspective on, is that being listened to? Is that being upheld? Is that being a conversation during the Senate hearings, or do you foresee that coming out at some point in time? Because as we know, it was stated too that 65 and older age group range, they're more than likely not going to be vaccinated until June. So I'm just wondering where we fall at with those conversations.
Yeah, so the vaccination piece is critical, and it was highlighted with one of the gentlemen that spoke yesterday, was that, you know, the word vaccination didn't show up one time in the governor's proposal, and to put a school reopening plan in place without even addressing the idea of vaccination just didn't make any sense. So it's a consistent message across labor, across management, across stakeholders that making sure that we vaccinate our educators is critical, and we need to make sure that that's done as quickly as possible. I've seen the June, you know, kind of part of the pieces. I think it's the local health saying we need more, but we need the product. We have to get the product. We have the people that can do the inoculations, but without the product, we can't move forward. And at this pace, it could take us till June to take care of it. So I do think work at the federal level, you know, President Biden put into place, like we did with ventilators at the beginning of the process, where he's encouraging manufacturers and others to be able to ramp up the ability to make the vaccine, distribute the vaccine. So I do think that process will increase dramatically. I'm very hopeful of that. But vaccines are more the answer than testing. Testing was the answer 6 or 8 months ago. Vaccines are the answer moving forward.
And going along the lines of testing, that stems into my next question. Being a district of our magnitude of around 62,000 students, and we're talking about testing them every 2 weeks based off the asymptomatic, we're in the purple tier. I was just curious, with the level of employees and staff we're able to keep up at this time, are you aware of any testing sites that would be able to produce the amount of tests that would be needed on that every 2 weeks cycle?
And it's even actually every week, but Rob's been more directly involved with the vendors that we're working with as far as capacity. I don't believe there's capacity, but that's my belief. Rob, you've had more of those conversations.
Yeah, Chris, you're right. And, you know, I appreciate the straightforwardness by the testing labs that we've spoken to, because they see dollar signs, quite frankly, too, right? So when they hear of a district of our size and that level of testing, certainly they want to provide it just to help their bottom line and to help our community. But at the cadences that are required under the governor's initiative, we have yet to find capacity in our region. And it's not just about one testing entity either, right? It's about lab capacity and the number of professionals that have to be involved to administer the tests and to oversee the test. So it's the number of tests, it's the lab capacity, and the number of professionals that can provide it. So money aside, there's some logistical shortcomings just to provide testing at that level. And, you know, we always try to see opportunities for success and how we can get these things done. But when you think about testing an entire school once a week and a testing lab that says we can only do 100 a day within a given time period, how you get a school of 800 kids tested once a week at an elementary school alone becomes difficult. And it takes a lot of time away from instruction.
And those same resources are people that could be focused on getting vaccinations done, because there's a limited number of healthcare folks, and they would be some of the same people. So I think the focus needs to be vaccinations.
Thank you. Again, I know it's hard to project out, and I appreciate the optimism that was mentioned about what in the future weeks potentially we could be looking at as far as the tier system. I'm hopeful. I just want to make the comment, just going back to when we initiated the school closure back in March. When we did that, that wasn't an easy decision by many of us. This was all new and the level of uncertainty. And for me, it's just going back to the plan of action, trying to ensure that we're aligning with the data and the case amounts of our county. And it's apparent in what's brought forth in this proposal as well. There's some very unanswered questions still, and there's some very concerning things that are left out. And so for me, it's just ensuring that I know with the level of uncertainty, we may open, or what I've seen in neighboring districts, to only hurry up and close down again because their rates have spread. They've had different exposures. So those are just some of my concerns as well moving forth. And I'm hopeful as more people get vaccinated, we will see that decline in the case amount as well, because it will be impacting the population totally in general within California. So thank you for the presentation.
Thank you. Ms. Chair Espinoza, are you available?
I am, Madam Chair. Sorry, I had to go off camera while I check on my son for a second. I've made some comments already. I just want to highlight one more comment that was made at the Senate hearing on this yesterday. Our counterpart, Richard Barrera, from a school board member from San Diego Unified, really summarized my feelings when he said, we don't need incentives, fiscal incentives. We don't need to be bribed to reopen schools and educate our kids the way we know that they need and deserve to be educated. We just need it to be safe. And as soon as it is, we will do that. And yes, we will need, financial resources to keep it safe. But, this approach that the whole program takes is frankly, it's insulting. It's the wrong approach, but I am optimistic that so many people are working on this issue, and hopefully we will get something that adequately supports all students, not just those who are able and whose parents choose to send them back in person. Thank you.
Thank you. Mr. Forcino?
I don't have any questions. There's certainly a lot that doesn't make sense, but it doesn't even make sense to ask the questions why things are being done that aren't appropriate. So the only thing I would say, because I've been asked by a number of parents, they've asked me, I thought the district was here to educate children. Why do we have to get the approval of employee groups? And for everyone who doesn't know, we're required as a result of legislative action to negotiate with bargaining units because it is a working condition. So it isn't children first. It's never been children first. That's sad. We should be able to do things that we think are appropriate. But as I say, at this point in time, I really don't have any questions. The only thing I would ask Rob, Chris, if you know, is why are our 7 to 12 grade kids not as important as TK 6?
Yeah,
I thought they were still kids.
Yeah, I can't speak to the governor's thought process with regards to who he values and doesn't value. I'm assuming he values all kids. I think what he's leaning on is that the little kids don't appear. I mean, and again, I saw another article today, the littles do get sicker in the new virus. So, but I think the thought process is that the littles don't get as sick. And that the older kids are basically mini adults, and they get infected and pass the infection on at similar rates to adults. So that's why I believe he's making the distinction, trying to tie that to the science. I don't think he's making a distinction about valuing one age group over another, other than the littles, the idea that littles are the ones harmed the most from not being in school. That might be part of his thought process.
Minister Fortuna, I know you know this, so I don't want to be Captain Obvious here, but for those folks, I do feel obligated to say we do have an agreement with our teachers to bring kids back. And we all thought that was going to happen shortly after October, if not early November. So we have that. It still remains in place. And what we're shooting for is to get in the red. And we feel like the new guidance that came out on the 14th, we're primed to follow that and to get kids back in the classroom based on our existing agreements and plan that's in place. And it'll be interesting to see what happens with the governor's proposal.
Nothing else, Beth.
Thank you. Mr. Perez. You're on mute, sir.
Point of information before I even start here. I'd like to know, my fellow board member, you're an educational consultant, Ms. Nancy Chaides Espinosa, and I would like to know what capacity or who were you representing at the Senate hearing, and who do you work, number two, who do you work for? Because I like to know where you're coming from, and also who you're representing at those hearings. And I think the community needs to know that also, because it's very important that us as board members, your perspective, and I do respect your word and your educational background and your work experience in the past, but yet I need to know as the board member where you're coming from and who you're working for, and if that would be a conflict of interest or
Okay,
an
I
issue.
understand.
Okay.
Yeah.
Okay.
I think I understand the question, and I mean, it's
And
great that
I don't want you to
no,
think
I'm
it's an
happy to
attack
answer,
on-
Tony. I'm happy to answer. I think it's
Okay.
interesting. We've been working together for 6 years, and it just occurred to you to
Right.
ask now, but that's okay. I think we've discussed my work quite a bit, but I'm happy to bring it again for
Right,
the
you
for
know
the.
what? Because it was because
I heard the question. I will answer
because I
it.
have
It's
not
fine.
kept up with your work experience, and it has changed. That's for almost
You are correct. So
Okay.
when I first came to the board, I was a lobbyist for the California School Boards Association, so representing all
Oh, that-
of our colleagues across the state. And
Mhm.
more recently, in the last couple of years, I've switched over to a private firm that represents primarily school facilities clients. So again, the members of the groups that I represent are school districts again. So it's us. And we primarily focus on making sure that school districts and county offices of education, and in some cases, community colleges have the resources that they need to build and maintain schools. So for this hearing that happened yesterday, I actually did not participate. I just watched it.
So you weren't representing a committee for Elk Grove Unified School District, but a private citizen or the organization?
I did not represent anyone because I did not participate. And I'm definitely, that's not something I do by default unless I had special permission, would I go in there and represent Elk Grove Unified.
And what's the name of this, who you work for?
If we can handle this offline, it's actually a little bit more complicated than that. I have multiple clients and I'm not sure that that's what we're talking about in this agenda item.
Well, okay, well, because I've read different reports and different organizations, and one very similar to that which you work for, or I don't know, I can't say, an organization, they do oppose or had some issues with the Governor Newsom's plan. So that's
none of the
what
organizations I represent have weighed in or will weigh in on this plan.
Really? So it's more than one educational component.
Mr. Perez, if you go to the last couple slides that in Mr. Pierce's presentation, you'll actually see links that will take you to a couple of the letters that we referenced. One of them was CSBA and county superintendents and a number of other organizations. And a second letter was, I think, headed by AXA and several of those organizations. So there's two letters there. So there's they call it the alphabet soup of of education from all the different groups. So there's several groups that signed off with very similar concerns.
Right.
Timelines, testing, using Prop 98 dollars to do something that's not Prop 98 initiated. Yeah,
but the reason why I asked, there in this particular summary of the governor's plan, there's this woman, Tanya Davenport. She's the CEO for California Association of School Business Officers, COSPO. So, and they took, there are some issues with the plan also. So thank you very much, Mr. Espinosa. I do not support going back and with your plan. I've told you and the community that I do not feel comfortable going back with your plan because of testing and the number of community members in our community who have not been vaccinated. They say we need to have our community 70 to 80% vaccinated in their community to feel safe after everybody gets the vaccine. But prior to that, I did not feel safe that sending students back to campus without testing negative. I would support going back to class, back to campus if everybody was tested negative and we had a good contract tracing system in place. Now, do we participate in any type of tracing, contract tracing program? How do we do contract tracing?
So I'll answer two questions first, 2 points. So one is, it's not my plan, so I'm not sure who you're talking to. It's the Elk Grove Unified School District plan, because it's your plan, it's my plan, it's our plan, because we agreed with it with our employees, and it was approved by the board, not unanimously, but that's how the world works. When the board speaks, that is so it is our plan. It's not my plan. We have a very systematic approach to contact tracing, and we've been doing it since March. We actually ramped up significantly in December because there were so many more tests during that the spike that we saw across the county. We experienced it here in Elk Grove Unified, and we shared that information with the board previously. And so we actually, beyond having our health services group work on it, we brought our risk management team into it with expertise and had some additional folks trained. So we are fully capable, and not only capable, but are actually doing contact tracing on a daily basis. I think it's safe to say, I don't know if we've had a day since we've gotten back from winter break that we haven't had done at least 8 contact tracing. So we are doing it. We are doing it well, and we have the capacity to do that moving forward.
And in the governor's plan, he says that we can continue to be on board into the school portal for outbreak tracing, which is called SPOT, SPOT, to improve collaboration between schools and health officials and members of the state contract tracing workforce.
And that may be helpful for some districts, but we have a system in place.
Communications with schools. So, you know, I have a lot of faith in the Department of Public Health and the governor and his staff and the collaboration that they're proposing. And so, you know, so what I'm saying that we should get on board with this little contract tracing little program, because they provide technical assistance and possible help us out.
Yeah, those resources are often made available, and they're often made available for smaller school districts and districts that might not have the internal capacity to do some of the work. So that's true of all kinds of issues across the state with regards to education. And the State Department does, and counties do a great job of providing support to districts that need that. We have the capacity to do the contact tracing, and we have been doing it and are doing it. If we needed some additional assistance, we know that that it exists and we could engage them. But as it stands right now, we have the capacity to take care of it ourselves.
And you feel 100% confident that we could handle our 62,000 students? Okay.
I believe we can handle our situation, yes.
Okay. And I see here testing. It says testing. The administration will support frequent COVID-19 testing for all schools, staff, and students, including weekly testing at schools and communities with high rates of transmissions. For example, any interested public school will be on board to the state-owned Valencia branch lab for PCR tests at 1/3 the market rate, and the state will establish a hotline to help schools implement testing. Now, do we know of that Valencia lab? Because I haven't heard you guys mention that. Or do you know of that Valencia lab?
We do know of the Valencia lab. We are currently working with a vendor locally so that we can get our tests turned around quickly. The ability, when we had our latest outbreak, the actual vendor actually brought personnel to us, so we didn't have to go to them, and we tested 45 staff member, I believe, and they did the testing for us. They came to us and did the testing. So the way the system is working currently, we have the resources in place and the agreements in place to be able to meet our needs.
Okay, so how much does it cost per test at this site?
$142.50 a test, but that of course depends on the type of test and what's needed with that.
Okay, it says that this facility is 1/3 the market rate. So, for your information, the hotline.
I just want to touch on that, Mr. Perez. I do know the governor offered that when he released his proposal. We're talking about one lab that's not in our region, and at the magnitude that we would have to produce these tests and coordinate the shipping of these tests, you know, statewide, you're talking with employees, you're talking over 7 million people. I don't
Right.
know I don't know of a lab that can support that.
Well, me, I don't know anything about these labs. Oh, I do know about these labs when I used to work in public health. So, so was this mentioned yesterday at the report at the hearing about testing about the
Yes,
Valencia?
it's one of the major concerns that all of the organizations shared was that they do not believe there's capacity to do what's outlined in the proposal.
And what was the comment they were going to do?
The governor wasn't there to comment.
Oh, his staff or anybody?
His
They
staff
weren't
was
there.
less than reassuring in my mind, Mr. Perez. And they have a lot of ideas on how to do it. They did not have a plan. And I will say that one of the things that stood out the most, and I don't know these senators' names, but a senator spoke to the fact that going back to school is of high priority and going back to school right is of the highest priority. And that this plan has the right intention, and he did not feel they have it right to be able to do it well. I have the link to the session, and I kind of thought you might have been on it, Mr. Perez. I am happy. I'll get it to Mr. Hoffman, and then you can listen to it as well. And I don't know, we could put it up on our district website. No?
Yes, I was planning to hear, but I was with my mother.
Yeah, no, I'm not,
86-year-old
no
woman,
judgment.
Erin Modesto, trying to get her a COVID testing and vaccine there in Modesto, California.
No,
So,
that's fantastic.
Mr. Perez,
I'm so glad.
I do want to share something. So if you go to the Valencia Labs,
I know where it's at. I know where it's at. I know where it's at.
I just want to read a quote, right, about this new partnership. And this is a direct quote. Through the laboratory, California will eventually be able to conduct an additional 150,000 tests per day. That's nowhere near the volume that the statewide school would need under this proposal. So it's going to augment the existing capacity of labs by 150,000 a day, eventually.
Okay. Well, I think that what they're talking about, when a school breaks out, like our school, that maybe that particular school send those tests of those particular employees and students, not the
No.
whole district. at
No,
one-
they're talking about asymptomatic testing of all students and staff on a weekly basis. That is everyone.
Okay, so anyway, so the PPE, all staff and students in school are required to wear masks. We all agree with that. Surgical masks will be recommended for school staff. So we have surgical staff, a mask for school staff.
That's a new twist. We have lots and lots and lots of masks. We also have N95 masks, which are even different. The surgical mask requirement for teachers is a different and new requirement. We will have those when we come back in person. The governor did commit to getting those to us as well, but we will have to wait and see what that looks like, because we will be primed to acquire our own.
Okay. Okay, it says here also, school staff vaccinations. School staff will be prioritized in the distributions of vaccines through the spring of 2021. So I support that. Testing, PPE, contract tracing that they propose, and the funding. Now, we talked about 95828 zip code, one of the hottest places of COVID-19 cases. That's within Area 1, the whole Florin High School, Rudder Junior High, and the elementaries. And then the month prior to that, we had Valley was one of the Valley High School region 3. So these people who work in these geographical area or live in these geographical area are working type people, face to face, they do not, like I said last time at our board meeting, these people don't telecommute. They don't distance work like state workers. They have to work in a place where they have face-to-face visits or services to the individuals. That's why, and they live in high concentrated living conditions. So these students need this funding source. We need to tap in this funding source so it doesn't, that's what it's designed for.
Funding
It's
source
designed
will
for
only test-
students in these area 3 and 1, where they're high poverty areas, high concentration of families with COVID-19. We need extra help and funding. As it says, these students will get,
Mr. Perez, we agree, but we think
Okay.
that $2 billion should just come to schools to use in the way that they need to use it versus it being carved off and all that money going to testing companies. We want that money to come to schools and for schools to be able to use it in the way we can serve our kids, our highest needs kids. But the way it's proposed currently, the testing companies are going to get that money.
your testing company getting 150 versus a third of the cost. So anyway, let me get back a train of thought here before you get me off of it again. So therefore, if we participate in this program, we get what? How much was an average? Maybe $450 more per student, plus supplemental concentration for more monies for funding because of COVID test high needs of these students. So we
Mr.
don't
Perez,
have that money to do that. That's extra money we could send these kids to summer school.
right.
year
Okay,
round.
Mr. Perez, what this means though, if we take the money, then our pre-K 3 kids or pre-K 2 kids go back to school when we get under 25. In
Yeah,
our plan, they don't go back until we're under 7. So if we take the governor's plan and we do what you just asked, we're gonna bring little kids back on campus when we're still above 20 cases per 100,000. And you're worried about bringing kids back when we get below 7. So if we take the money, the governor's
okay,
telling
okay.
us we have to bring kids back as soon as we get under the 25 number. That's what he's saying.
okay.
Within 5
But
days.
that, like you said earlier, that is being debated in the Senate and also Assembly and
The whole
school
thing's
districts.
being debated.
So we need to just say, hey, let's participate and let's wait out and see what they recommend.
All right. That is your
I'm not
position.
finished. I'm not finished.
Okay.
Mr. Perez, you understand there's nothing to participate in right now.
I know that, but what do you call it? Well, let's have an open mind that, that, hey, this could be pretty good after they make all the changes. To me, you're closing the door right now, saying all this negative stuff.
We're not closing it. We're saying the way it's proposed right now doesn't work for us. But it could change, and it's gonna change.
Exactly. That's what I'm saying.
That's fine.
Okay. And I think it's a good program. But like you said, hey, they got to work out some of the issues. I mean, they're going to have to debate this or that. And that's what's happening right now. The doctors and the scientists and all that stuff. But on our plan, if they go back to school, we're going to get all the money if there's a major outbreak. You're not going to get, you're going to lose out $450 per student if we don't participate. And that's a lot of money between district area 1 and 3, a lot of money and extra funding for this issue. So, I mean, let's not close the door on this program or say, we're not going to participate.
Understood.
Okay, that's where I'm coming from. And then there are some other issues that I've read about this program that the, yeah. So we just had a presentation by 2 of our districts, and they were talking about the impact of this COVID-19. And what I see here, that's where it's geared to. Some of the issues that our administrative principals and teachers of those districts that the rep talked about this morning, they need help. And this is kind of something that, this extra money could help out on those issues that they brought to our attentions this morning.
Mr.
Mental
President, we
health,
understand. We understand that.
isolation.
We understand that, Mr. President. If it gets written well,
Right.
and we could participate, but the way it's written now, it doesn't work.
And
Well-
there's nothing to participate in at this point, and they will keep us updated as it changes, Mr. President. We have not closed the door on the idea by any means.
Well, I want to make it perfectly clear what I've read and seen. It's he has very good intention, and it could work if people come on board and speak up, and I'm going to speak up on behalf of these students.
People are speaking up.
Okay, thank you.
Thank you, Mr. Yang.
And our staff.
I just want to thank you to Rob and Jen for presenting a good presentation. There's a lot of information to digest. Quite frankly, it's a lot. But we have information that is somewhat promising in terms of funding from the federal to state, and then but somewhat is controversial, especially the governor's plan. And I, for one, also have children in the district, and I see that the distance learning, it's affecting my kid as well. As far as not being as productive as I want them to be in terms of learning. And I see a lot of parents out there are concerns about their kids and not back to school in person learning. So I see that frustration, and I'm also frustrated. But on the other side of the coin, seeing the COVID cases going down, it's a good sign, and people are getting vaccine. That's great. I myself received the 2 shots already because I'm a healthcare worker. So I know that this is uncertain times since last year, and it really still is uncertain times, and there's many uncertainties. And I just want to speak to the constituents that we'll do our best to bring the students back on campus schooling as soon as possible, but safely. And thank you.
Thank you, Mr. Yang. I, again, if you have the time or inclination, I would, the hearing was very interesting. It was very telling. I don't learn everything the first time I hear it, so it's very helpful to hear it again. And listening to it, there were very many repetitive messages from very varying camps, so that was interesting. 2 things that stood up to me was people that have testing systems, and even the talk of how long it would take them to gear up a testing system that was of this magnitude, even though they already have things in line. I remember when we asked Dr. Kasarian if she would be able to do such a thing when she was here through Sacramento County, and she said, no, not at this point. And the point that Nancy made is that we don't, I appreciate the huge focus on getting kids back to school at the Capitol and the people that are working on for us. And while we appreciate all the money and the support, we're bringing kids back when it's safe to bring kids back. And I'm very proud of the work we've done. We got a whole new set of marching orders on how to open school safely. And it really appears to me the biggest change we need to make is we need to buy some different masks. So, I mean, congratulations to you guys. We talk about coming back to school. We do school well. We've done school well for years, and we'll get back to it. So that's my last comment. Thank you for that report. We have Mr. Hoffman would like to close. I know Mr. Fortuna had an appointment. I appreciate him making changes to be with us most of the day. Mr. Hoffman wanted to make some comments about the trustee interview process, and then we will conclude today.
Thank you, Ms. Aliani. So I'm gonna have Ludi throw up a PowerPoint. It's relatively quick. Just want to give board just kind of a highlight of what Tuesday is going to look like. So folks are comfortable. And we'll also, and for our community, and we'll go over this one more time with the board at the beginning of Tuesday evening as well. So this is what the agenda will look like on the next slide. And we will we'll start with our Pledge of Allegiance, and we'll be looking for a volunteer soon, so step up if you're ready. Then we will do a quick orientation with the board to make sure everybody's on the same page. We'll actually do the interview of the applicants, and we have 4 that we will be interviewing, and I'll go into detail on each of these bullets real quick in a minute. We will have a public comment opportunity for folks to share with the board their thoughts, and I'll also talk about what that will look like, because it'll be a little different than we normally do. And then the board gets to deliberate. It's one of those things you get to hire, or you're hiring somebody doing interviews. You get to do it in public in front of everybody. So it's kind of a little different process than you usually do in selecting somebody. And we will swear that candidate, the new person in that evening. So it will be an exciting evening. So we'll go through the next couple slides and talk about the actual interview process very briefly. There we go. So they will be joining us virtually. So this will be our first version of a virtual interview process. Generally, we've sequestered them in a room, and we bring them in one at a time. And when this is being done in public, that makes it very difficult to do. So we have the 4 candidates. We've actually already run them through a random selection process and put them in an order. And then what we'll do is we will ask the first question. It will show up on the screen, and candidate number 1 will answer the question. And candidate number 2, number 3, and number 4. And then we'll go on to the second question. And at that time, the second candidate will answer first, and then we'll go through the order. So we'll go through the questions in that way until all of the questions have been answered. And we'll work through that process. At that point, obviously, throughout that process, the candidates will be part of the meeting. Once they have completed their answering, we will ask them to turn off their video and their microphones for the public comment section, which we'll talk about next, and for the deliberation. So the next piece will be public comment. So a little bit different than normal. So we will publish this agenda tomorrow before end of the workday, and the public comment section will be open immediately. It is a special meeting, and so the only focus of the meeting is the interview. So really, people could comment, we think, in one of 2 categories. They could comment on the process if they wanted to share with the board any thoughts they had about the process, or they could share information they had about one of the candidates. So what we're going to do is we'll open up public comment at the point that we post the agenda, and we're going to keep public comment open throughout the meeting until 15 minutes after the last candidate answers the last question. Because what we believe is many people will not know who these 4 candidates are, and them listening to their answers based on that, they may want to provide the board with some information and some feedback based on what they heard. So once we close public comment, we will take a 20-minute break. So the board will probably want to take it, and that will give staff an opportunity to organize the public comment, and then we will come back into session, and we will do the sharing of the public comments with the board. And then deliberations and selection, and then the fun happens. The board gets the opportunity to have a deliberation and discussion with regards to the applicants. We would, as a general point of order, the conversations and the deliberations should be focused on the applications, which you will receive in your board packets this afternoon. That information will be there, and the information that you're hearing from the candidates during the interview. And in the end, there'll be an opportunity for a motion, then a second, and the board will take vote and choose one of the candidates, if the board can agree on that. And we swear them in. We don't waste any time. We generally give the candidate the opportunity to ask if they would like the board president to swear them in, or me, and so we can do either one of those. And the last thing I'll go through very quickly, I just want to show the timeline of all the things that we've already done and we said we would do, and the 2 things that we have left to do. So the board made the decision to fill the vacant seat based on a appointment. We immediately went out and did a advertisement. We did that across the district. We got the applications in. The window closed on January 14th, and then we did a subcommittee met. I want to thank the subcommittee, Ms. Childers-Espinosa, Mr. Porcina, Mr. Perez. They did their homework. They took it seriously. They read through the applications. They went through a process, and they narrowed it down to the 4 that they believed were most ready to move forward for an interview. So we have those 4 people. So the 2 things we have left to do, January 26th on Tuesday, is to actually run the interview process, swear the person in. But we do have one other requirement after that, is we have to tell the entire public that we made the appointment. And then there is an opportunity if somebody wanted to file a petition for a special election because they didn't agree with the appointment. That process does exist. So we're hopeful that being transparent with the process and everybody's seeing the interviews and seeing how well it's done, that won't be the case, but it is just part of the reality of what we need to do. So those are the ideas. Open to thoughts or questions, but that's the process.
Madam Chair, are you going to go through the list?
Sorry, what list?
Oh, just go through us for questions or comments.
Oh, yes, sure. We can start on the other side. So we would start with Mr. Press. You're on mute, Mr. Press.
Okay, page 3.
What was that?
Page 3 of the presentation. Candidates will be invited to join a virtual meeting. Now, do we have a time frame of these 4 candidates? Kind of, we're going to start meeting at 6, correct?
5 o'clock.
PM. So, okay, how long do you anticipate questioning each particular board member? How long? Any idea?
We plan to give each candidate up to 5 minutes to answer their question.
How many questions?
4.
4 questions.
And then a closing statement.
5 minutes and closing. How long is closing?
3 minutes. 3 minutes.
Okay, closing. Okay, so 4 questions, 5 minutes to answer. And then how much time we're going to give the public comments? How long is that going to be?
We won't know that until we actually find out how many public comments we have. So we'll have that's part of the piece. We'll have to see what that looks like. We never know. If we get 5 public comments, it's one thing. If we get 500, that's another thing. So we'll have to make that. That's why we're asking for the break, so we can get them, we can organize them, and then we can work with the president to figure out how we want to do that moving forward.
Okay,
Mr.
good.
Perez, at a minimum, we will announce everybody's name who put in a public comment if it was related to a candidate.
So is there a due date if they want to make public comments?
They can start public comment as soon as we post the agenda tomorrow. And that window will stay open until 15 minutes after the last candidate answers a question. Anytime during then, they can do it.
So they can watch the candidates and make a comment after they watched the candidate, the four
Okay,
candidates.
so it's open all the way to the last candidate. Okay, I'll make that clear. So what was the beginning date?
Beginning date of what?
Just, request time?
I don't understand the question.
When does public comment open? Is that what you're saying,
Yes,
Mr. Perez?
yes. Uh-huh.
When we post the agenda tomorrow afternoon, so probably 4:30, 5 o'clock. Actually, this afternoon. We're gonna post
I was
it here.
gonna say it's Friday.
It's Friday, yeah. So it'll be
Okay.
this afternoon. We posted this afternoon by end of business day.
Okay, good. Okay, today at 4:30.
Or 5.
Or if my board gets done with me sooner, I might get it up even sooner.
Okay, are the public comments gonna be 2 or 3 minutes long? What's the time limit on public
What
comment?
we've done is we have it set up for 2,000 characters, which gets us to about a 3-minute read.
How many comments? How many characters?
2,000.
2,000, all right. Am I asking the right questions?
You're right on target, Mr. Perez.
Okay, 2,000.
Just don't ask me an
3
LCAP
minutes.
question right now.
3 minutes, right?
Yes.
Hold on here. Then let me see. Oh, when the candidates come, who's going to ask the questions? Board members or a staff?
Each of the board members will have one question to ask.
Okay,
And I'll work with Ms. Alviati and I. We worked through the questions yesterday and we'll work on question assignments before Tuesday.
okay, good. So board will ask.
It'll be important for the board to know that they can only ask the question as written or reread the question, but not do follow-up and not go off on other ideas. We have to stay and be fair to all the candidates by asking them all the same question.
Same questions, same words, exactly. Okay, good.
Yep.
Okay, so I got that process, the board package. Oh, you mentioned we probably have a board package today, right?
It's probably on its way right now.
Right now, let me look outside.
Might be knocking on your door.
Okay. That's it, I guess.
Sounds
Great.
good. Thank you. Appreciate
Thank
it.
you, Mr. Yang.
Well, thank you, Mr. Perez, for asking all the great questions. That really helped clear up some of the question I have.
Yeah.
But as a newly elected school board trustees who just went through I would say, a very long and tough campaign, I pretty much ran the campaign the whole year of last year. And as I am hearing, it's going to be unfolded in front of me next week, new appointed trustees. I would say whoever that's going to be appointed is very lucky that didn't have to go through what I went through. But unfortunately, I feel that it's a little bit concerning as well, because it rests in the hands of 6 individuals who's going to be voting versus, like my case, over 130,000 constituents, which I got about 60,296 votes, if I remember correctly, which is phenomenal. But anyway, nevertheless, we already vote for it. I will, go with the majority. And I trust the process that we, as a board, the majority has voted for. So I'm going to go with it. However, I do have a question for Chris. Now, Chris, from what I guess I could just reiterate some of the stuff that I heard, just make sure that I hear it correctly, because this process is very important to all of us. So I want to make sure I understand very clear. So the people who wants to submit public comment toward this item, as far as we know right now, we don't know how many, and then we don't know if there will be a huge number. If there is a huge number, there will be a decision to make in terms of how many public comment will be read, right?
How much time will be dedicated. One thing that I think we'll be able to do is, again, we have to be a little bit flexible because we just don't know what it's going to look like. But if we should be able to turn around and give the public comments electronically and send them to the board as soon as we have them ready. So if there are a large number, the board could actually see them all. I think we would be able to turn that around. But again, just kind of depends on how many we get. But we'll do everything we can to make sure that the public has an opportunity to have an impact on the process, and that's why we've left it open, until after all the candidates have spoken, so that those folks that don't necessarily know any of the candidates, they have the opportunity, and those that do know them, they actually get to hear them answer the questions that the board asks. So we're trying to make it as open a process as possible.
Okay, so in my opinion, I really encouraging the constituents who lives in our school district to really submit as many public comment as possible, because I think it's a very important appointment that we have coming up. So if you care about the school district, you care about your representative for the school board, please submit your comment to support whoever you want to support, because this is it. I mean, it's going to take another week, the 26th, right? So that's literally 4 days from now to appoint a very critical trustees to fill District 4. So I think it's very important. So I would encourage whoever out there that lives in our school district to look at our candidates, and whichever candidate that you see, I hope that you know who they are. And if you support them, make sure you write up a supporting letter and submit it to the public comment on this item of selecting a new trustees. And I would encourage us, hopefully it's not like 1,000 letters. Hopefully it's, a little less than that, who knows, right? But for me personally, I would like to hear all of them personally, because I think it's very important to hear what the public has to say in terms of, who they like. So anyways, those are my comments and questions. And I thank you for the subcommittee, Tony, Carmine, Nancy, and of course, Chris and his staff for putting, and Beth as well, for putting these, this process together for us to appoint a future newly elected trustees. So thank you.
Thank you. Mr. Fortuna had moved his appointments to be able to attend the earlier part of our day, or basically all of our day except for the last 10 minutes, and now we've gone over. So Mr. Fortuna has had to leave for his appointment. Ms. Charis Espinoza?
I'll be very quick, Madam Chair. I just wanted to ask, I think it's a question, not a statement, but Mr. Hoffman, you mentioned the appeal. I believe the appeal is meant to be limited to procedural grounds, right? It's not meant to simply appeal because you don't like the person selected. Is that correct?
Correct.
Okay, thank you. And just want to put something else on our agenda. I guess it would be for the board secretary, but for whomever is appointed, I hope that we can get them plugged in for CSBA new school board member training as soon as possible. And if they've missed the regular opportunity, that we do whatever we can to supplement that.
Yeah, they're already, this isn't the only one happening across the state. And so folks are ready at CSBA to put those sessions in place.
Thank you, that's all.
Okay, Dr. Martinez-Soler?
No questions, just mainly comments. I appreciate the committee for bringing forth the individuals with the names and the work that's gone into the process. I know from experience, having been on one of these processes before of appointment for the next 2 years. So just a reminder, refresher, the appointment is for 2 years, and after that, there will be an election for the position. And if there's opposition, that may happen or not. But again, sorry, I got my little one in the background.
That's good
It's her
noise
nap
right there.
time. So again, I will look forward. I'll look forward to seeing the public comments. I know for the sake of time and to be respectful of individuals, I hope if we're not able to hear all the public comments that evening, that we are able to at least be sent a draft of them so we can read through maybe or take an extra 10 minutes or whatever the case may be of some of the public comments. Again, just not knowing how large the comments may be and being through a cycle of this before, it can be very lengthy, I know from experience. So I look forward to the process and this continuing on, hopefully soon, with getting a new person selected.
All right, thank you very much.
Hey, Beth, can I ask one more question?
Sure.
Hey, Chris, we absolutely have to vote it that night, or can we postpone to a different time to vote?
Generally, the way the process works is you do the vote that night.
Okay, so we absolutely have to do it that night.
That's what we've told our public we were going to do. That's the process we have in place.
And
Okay.
there are also statutory deadlines. So yeah, we basically have to do it that night.
All right, thank you.
It is a weird process. I've been there once. It yielded a fantastic person, Ms. Charis Espinoza, who then proceeded to run for her seat. And just as I think we have to have faith in the process and come to it with an open mind, being as fair to the point of the interview and the application of our judgment of who can serve best in this interim position until we are able to have another election. And I thank everybody who has put in their name and their interest to serve our district. And I congratulate the 4 that have come to this point. And please know, no matter what happens that night, you leave with the respect from our whole board for your willingness to do this job. So that's all I have to say. We're good to go.
Yes, ma'am.
Thank you. Have a great night. Take care. We'll see you guys early next week. Bye.
Have a good
Thanks
night.
all.
Everyone.
Bye.